Hello everyone. Today is May 11th, 2015. I will speak about the doctor for the healing of the sick patient. The doctor is very important in the healing of the sick patient. The doctor must show an exemplary behavior of sincerity, educated and humane to heal the sick patient. The doctors go to school to get a good education to heal people when people are sick. The doctors must be respected from all the people because they are educated, humane towards people, and heal the sick people. The doctors that are educated, humane towards people, and that heal sick people are true humanitarians. The doctors of the science of medicine must work with clever attention for the medicine to be the best to heal people, to produce medical technology that is the best, so that sick people do not get harmed when they have surgery. The doctor-scientists of the medicine that produce medicine and medical technology, together with the surgeons, must keep responsibility that sick patients do not get harmed. The doctors who are specialists for people's diseases must check the nurses with cameras for the service they give to the sick patients. There are patients who do not speak or cannot get up to check themselves what medicine is given and how the nurses serve them. If the patient that is sick is heard from the services of the nurse, the doctor should remove the nurse from the job and the nurse should be punished by law. The sick people give trust to the doctor for the medicine that are given to cure diseases, to heal the sick patient. The doctors who are specialists and the surgeon doctors should observe with attention and cleverness that the sick patient gets all the medical tests done. After the disease is found, the sick patient can be cured for the disease that he has. There are sick people that have emergency because of their disease. Medicine should not be given to the sick person without knowing what disease he has. The doctor, if it is possible, must do all the medical tests himself for the sick patient to find the disease when there is an emergency. But when the nurses draw blood, the doctor must check with cameras so that the sick patient is not harmed, how blood is taken, how much blood is taken, and how the test is done. In the blood tubes should be the name and last name of the sick person, and the doctor must verify with camera when the test of the sick person is done, because this is very important. Sometimes the nurses draw 12 to 20 tubes of blood. There are attentive nurses, but there are some who do not do the tests right. There are nurses that cannot find the veins and they prick the arm of the sick patient 6 to 10 times. But those veins are in the body of the sick person, so it will hurt when he gets pricked with a syringe. Where is the attention of the nurse to find the vein of the person? The nurse should see with attention where the veins are before they put the syringe in the sick person's arm. The nurses that give the patient serum must be careful with the sick person because the arm gets swollen, he feels pain, the arm gets numbed, the vein gets swollen where the syringe is placed. The medicine of the syringe that passes through the tube must be fixated well, because the patient gets sick and the doctor doesn't know that the syringe takes air and the sick person feels pain. The syringes that are used to give the patient medicine must be unopened under the observation of the doctor and the patient. It is the best that the doctors that serve the patient or the doctor-surgeons do the medical test themselves to cure the patient for the disease he suffers. When the sick person goes to the emergency or when the patient calls the emergency, the doctor should be present with the sick person to check the patient immediately and to take the tests at the same time that the doctor checks him. The patient should not wait for hours in the emergency until a doctor comes. There are people that faint because of the difficult diseases. There are different diseases that are difficult for the people, for example, paralysis, stroke, etc. Until a doctor comes, the person might be finished. The doctor should always have with himself and in his workplace all the medicine according to the disease of the person. The director of the hospital must keep rules excellent and must keep responsibility for the sick patient if they get harmed with their lives. The director of the hospital must keep doctors who are specialists in emergency and must keep doctor surgeons who are specialists and nurse specialists who have very good record. Doctors must be capable, humanitarian, and attentive in their jobs and be prepared to cure the disease of people. The director of the hospital must keep in hospital officials who have a very good record. The nurses should not make noises in the environment where the sick stay, but must serve the patient attentive, without noise, educated, and peaceful. The rooms where the sick stay should be cleaned every day, and the bathroom should be cleaned often from the cleaners with the responsibility of the doctor of the hospital. If the nurses create noises in the environment where there is sick patients, the doctor should evict them from their jobs. The doctor-surgeon, when he does surgery, should see carefully that the apparatuses of the surgery are clean and sanitized. The doctor-surgeon has responsibility for the sick patient. The persons that service with the doctor-surgeon should be specialized as doctor-surgeons for the surgery of the sick patient. The doctor-surgeon should do surgery on the patient only when he is very sick and cannot be healed in any other way. If the disease is cured with medicine, there is no reason why the sick patient should have surgery. The organs should not be removed from the body of the human if the person can be healed in other ways, because it is an epidemic for the health of the people. It should be a law that the specialist doctor and the doctor-surgeon, if they do surgery on the sick patient, they should sign with their name and last name that the surgery will be under their responsibility, that the surgery will be successful, and the sick patient will be well. The rooms where the sick patients stay should be separated according to what disease the sick patients have, because people can get sick from others who have infectious diseases. The food kitchens of the hospitals should be excellent and controlled by the doctors and the public health inspectors of food. The foods should be given to the sick patient according to what diseases the sick patients have and according to what the doctor recommends. Also, there should be excellent food for the family of the sick patients, even if it is with money. The cooks of the hospital should be food specialists and should be with a very good record. The food that is given to the sick patients should be given under the control of the doctor. If the sick patients get hurt from the food even a little bit, the person responsible for causing this harm should be punished with law. The hospital should be investigated from the investigators of public health and the investigators of justice. I have seen doctors of emergency room and doctor-surgeons that have been humanitarian and attentive for the healing of the sick patients in the Hospital of St. Mary's of Waterbury in Connecticut in the United States of America. One of these humanitarian doctors of the emergency that served the sick patients attentively, educated, and who found the diagnosis of the sick patients was Dr. West, and the doctor-surgeons that I saw who were peaceful, educated, humanitarians, and who operated on the sick patients attentively were Dr. Shady Macaroon, Dr. Landon, and all their group of surgery doctors. And also nurses, Davis, Pam, that served the sick patients were humanitarian. The nurses were attentive toward the sick patients. I wish all the best to these doctors and nurses, and that they always be humanitarian, educated, attentive for the healing of the sick patients. I wish the best to all other doctors and also nurses wherever they are, and that they be humanitarian, educated, attentive for the healing of the sick patients.